Hi, welcome to the DRH Show, where I have wide-ranging conversations with fascinating people. We talk about all things psychology, mental health, and well-being. Today, I'm joined by an internationally recognized expert in the field of family counseling, Dr. Brian Canfield. Thanks for joining me.
Delighted to be here. Thank you for the invitation.
It's great to have you here, Dr. Canfield. So if you could just tell us about your background, your trajectory in life, and how you ended up doing what you're doing.
Sure. Yeah, well, I was born in Louisiana. It's my home state, and currently professor of clinical mental health counseling at Florida Atlantic University in Boca Raton, Florida. So I actually split my time between Florida and Louisiana. I've been in the field of psychology and family counseling since the early 1980s. I'm in the U.S. licensed as a psychologist, as a marriage and family therapist, and also as a mental health counselor. I've been kind of, in addition to my academic career, I've held appointment at 5 universities as a tenured full professor, and also have played various administrative roles over the years. I've served as department chair for 8 years, associate dean, and did a brief stint as vice president of academic affairs for a state university. But I've always maintained a clinical practice. I've always been involved in working with clients because I feel if I'm going to be effective in the classroom, that being able to draw real life experiences with my clinical work is very important. Parallel to this, I've also been involved in leadership roles in professional associations. I am a past president of the American Counseling Association. I also served 2 terms as treasurer of the American Counseling Association. And as well, I'm a past president of the International Association of Marriage and Family Counselors. Currently, I'm involved in a leadership role with a new organization, the International Association of Psychology and Counseling. We actually just launched earlier this year, and we're a growing organization that is, I'll be sharing some more information with you about that, but growing organization currently in 14 countries, and our aspirations are to have a positive global impact on the field of psychology and other mental health professions.
Now, Dr. Canfield, I visited your website, and it says there that your clinical work in the area of applied cybernetics is widely cited. Now, I have to be honest, I've never heard of that. So if you could just kind of educate me, and also for those who have not come across with that area, what exactly is applied cybernetics?
Love to talk about cybernetics and applied cybernetics. It basically has to do with the interrelationship of people that those of us who are trained from a systemic perspective believe that most, if not all, problems of the human condition are embedded within some type of relationship issue. Now, it may not be the causal factor, but it has to do with either maintaining or ameliorating that. So cybernetics is actually a fairly new word. It dates back to the early 20th century, and it has to do originally looking at mechanical systems in terms of how things interrelate and interconnect and kind of co-construct and create a system. If you're looking at, say, for example, an air conditioning central air system or a heating system, the thermostat, the fan, the cooling or heating unit kind of interact in a way that maintains the temperature of a room. Well, applied cybernetics looks at the aspect of a relationship. It could be a dyadic relationship between 2 partners. It could be a family relationship. It could be a employer-employee relationship. And it looks at bringing these systemic concepts into the clinical realm of how we can help bring about change. So for me, that's kind of the central way that I approach my therapeutic work is through a lens of cybernetics, which I believe is a very useful way. It's certainly not the only way to look at issues, but to me, it's shown to be a very useful way to help people address issues.
And of course, Dr. Canfield, applied cybernetics is just one component of what you do. You're primarily interested with marriage counseling or couples therapy. Now, I suppose you've been always asked this question. A lot of people there are some people who are quite hesitant when it comes to counseling and couples therapy because we can usually handle problems on our own. So what's your take on that?
Well, I don't, I kind of reject the notion of individual therapy or couples therapy or family therapy. We're all embedded as humans. We're a species that are embedded in some type of social system, some type of relationship system. We're born into that type of family of origin unit to some degree. We don't even reach the age of viability as a species until probably 4 years, 5 years old at the very, very minimum with that. So we're born into a relationship context. And for most humans throughout their lives, they're embedded in some type of either a dyadic relationship, family relationship, group connections, and that sort of thing. So I think recognizing that the idea that we somehow can parse a person's life and take them out and look at them individually, devoid of understanding that relationship context is very limiting. It's kind of like trying to put together a jigsaw puzzle with half the pieces missing. So I find it useful in working with a wide range of mental health issues to often include significant other people in the therapeutic process. Now, that could be a partner, it could be a spouse, it could be a close family member, a friend, somebody who's tied in with that. So I think that tapping into that social network, tapping into those significant relationships, not only can help us gain a better understanding of the problem issues, but it also can be used as a tremendous resource in terms of ameliorating those problems. There's some recent research in the area of substance abuse that shows probably the highest predictor of not relapsing with substance abuse is to establish and maintain a supportive social network. And I think we see evidence of that time and time again, particularly use an example, Alcoholics Anonymous in the United States has been successful with many, many people. And my own personal view is I think a large degree of that is it creates a social network. It creates a group of accountability that kind of serves that social function that is so necessary for healthy living.
What about medication? Is it not an alternative to therapy?
Lots of studies about that and lots of controversies about that. And many of us in the field have differing opinions about it. I think that our society has drifted in two directions that are, or two ways that are kind of problematic. One is there's been a tendency in the last 50 years or so to pathologize an array of problems. We used to look at it through a lens of conduct and choice and consequences, but now we tend to pathologize a wide range of social problems and individual behaviors with that. And we also tend to, since we do pathologize it, we tend to look at medication as a way of suppressing symptoms that often emerge. I'll give you a good example. If someone passes away that's close to you, there's a sense of grief, a feeling of a loss, a feeling of maybe even despondency. And we tend to look at that as a bad thing, as if somehow we have to get rid of those negative feelings that emerge when life events occur like that. And I would say that that's a normal process, that a certain amount of circumstances in life will cause symptoms. Depression, anxiety is a good example. I think they have survival value. I think symptoms of depression, symptoms of anxiety provide feedback to us from the environment to say that something's not working and it needs to be changed. Now, can medication be helpful in addressing these symptoms? With some individuals, absolutely. But for others, there are undesired side effects, for lack of a better word, that occur with a wide range of antidepressants, SSRIs, various things like that. So my own philosophy in terms of a clinical approach is that medications can be useful. They need to be looked at on an individual basis by the patient and their medical doctor. But I think to look at it as maybe a bridge to get a person from where they are to where they would like to be in life could be an adjunct to therapy. But I think that changes in style of living are much more important in bringing about an improvement than to try to simply artificially change the biochemistry of one's brain in order to feel better.
Absolutely. And of course, there are a number of studies which actually support the therapeutic process rather than just, giving medication straight away. So good points there, Dr. Canfield. Now, of course, aside from couples therapy, you also offer individual therapy through your clinic. And I noticed that on your website, you mentioned that counseling should be a relatively short-term process. Why is that?
Well, it should be, because I think that we have to look at counseling and psychotherapy as something that is invasive. We're taking a person's time and energy and money to engage in a process to bring about desired change. And so there should be some results to that. There was a study that was done a number of years ago by a fellow named Howell. He looked at, I think it was a meta-analysis of 18 different approaches to counseling and psychotherapy. And he found something very interesting. He said across theoretical approaches, across therapeutic approaches, that if you apply some type of intervention, that there should be, on average, is about a 70% improvement. About 10% of people are going to worsen, and the remainder are going to remain about the same. If you contrast that with no intervention, that there's usually about a 50% improvement rate just through spontaneous circumstances. So no therapy, half the people are going to improve with that. That means half are going to stay the same or get worse with it. So we know that therapy as an endeavor is more effective than doing nothing. However, Howell's study said that of people who do change, that the vast majority are going to improve in a short duration of 6 months or less. Now, on average, we have to look at this as aggregate data, not applying it to an individual. So what we glean from that is to say that if someone is working in therapy and they're not recognizing some noticeable improvement within a 6-month period, that they should either change the approach, or that the therapeutic relationship should probably undergo peer review to find out extenuating circumstances. Now, there's certainly many clients who require much, much longer than 6 months duration. But it's interesting in this study that Howell did, that a third of the clients who improve, of those 70% improve, 1/3 of them will improve within 1 to 8 sessions. The remaining 2/3 will improve between 8 and 6 months, which is about 26 sessions. So when we talk about brief therapy or short-term therapy, we're really looking at 6 months duration or less. We're not talking about 4 or 5 sessions, because the data does not support that the majority of people who will improve are not going to improve within 5 or 6 sessions. About a third will. The majority are going to improve, take a bit longer. But again, I think 6 months should be the kind of the benchmark we look at.
Mm-hmm. Now, Dr. Canfield, if you could just go back to your work as a couples therapist, what do you think an individual partners do for themselves to improve the dynamics in the relationships?
We know that relationships are they're dynamic. It's an ongoing challenge for couples to keep a relationship and make it work. And what we found in some of the research, a colleague of mine at University of Colorado Springs, Dr. David Fennell, did a study some years back where he looked at long-term couples that had been together at least a decade, and some 20 years, 30 years, 40 years, and so forth. And he said that all couples start out together because there's some commonality or common benefit for it. But over time, in every relationship, there are stressors that couples tend to drift apart. Now, this is true of couples that end up divorcing as well as couples that stay together, but they drift apart, and the couples that stay together find some way to kind of reconnect with that. But for other couples, when they drift apart, they start questioning the viability of the relationship. My partner doesn't love me. I don't feel toward them like I used to. We're frustrated with each other all the time with that. So what this study revealed is that all relationships tend to kind of look like this. You have periods of closeness and togetherness and periods of separation emotionally. And the key is not a subjective feeling of love and affection toward your partner. That's going to ebb and flow. There are times you're going to feel very positive toward them. There are times you're not going to feel so positive. The key is commitment. For couples who are committed to the relationship and the long-term durability of the relationship, they can find ways to work through those problem issues. I'd say 60% of couples that come to see me in my private practice do so because of an affair or the suspicion of infidelity, the suspicion of an affair. And that's where the spotlight goes. Everybody's concerned about their partner cheating on them. But I approach that as a symptom of the problems in the relationship, not as the problem. Now, it's like the fever if you have a virus, the fever can kill you, but the fever is a symptom of the underlying infection. And I think the same thing with infidelity in a relationship. It is a symptom of underlying problems. And so a lot of couples can work through those issues. But again, the key is commitment. And that's something that each person has to make an individual determination of.
Now, let's move on to some exciting developments that you've led recently, Dr. Canfield. I understand that you're also the founder of IAPC, the International Association of Psychology and Counseling. So first, what is IAPC and what led you to establish it?
Absolutely. Well, IAPC is the acronym for the International Association of Psychology and Counseling. And I would say that I've played a central role in the organization of this, but it's by no means something that I, founded on my own. This is a group of colleagues who came together. Earlier this year, we assembled a exploratory committee to look into the possibility of creating a new professional association, one that was differed from what the choices are out there for many professionals. Now, the mainstream associations that we were looking at, and many of us have been active in those associations and members of, would be the American Psychological Association, the American Counseling Association, American Association for Marriage and Family Therapy. And these organizations have done great work over the years in terms of creating a professional identity, but tend to be kind of segmented. If you're a counselor, there's a home for you in ACA. If you're a psychologist, there's a home for you in APA. Marriage and family therapy, there's a home for you in AMFT. Many of us are licensed in more than one discipline. And we also recognize that there's tremendous crossover among disciplines, that they're not clear, separate, and distinct silos of practice, that they're probably 80% overlap in a lot of areas with that. Psychologists do marriage and family counseling. Marriage and family therapists do individual counseling. Professional counselors do testing. There's all kinds of overlap with that. So there were a couple of things that are really at the core of the creation of IAPC. One is that we wanted to create a truly international association. So we contacted colleagues. I've done a lot of international work over the years, spent quite a bit of time in Europe and Turkey, the Middle East, Asia. Most recently in China, did some workshops in Beijing on couples therapy. And so in knowing these colleagues in other countries, we knew that there was an interest in developing a global organization that would be culturally sensitive to each country and each community. So while problems of the human condition are universal, the way that we address those problems are specific to the culture in which they're occurring. So you're going to deal with relationship problems differently in Saudi Arabia or Malaysia, which are Muslim countries overwhelmingly, than you would say in the Netherlands, or you would in the UK, or you would in the US. And so that's true with a wider range. So what we wanted to do is to bring an organization into the forefront that would allow this exchange of ideas so that we can learn from each other. So the first, I guess, foothold of this first foundation is that it is international, it's global in perspective. The second thing that I would mention is that it's interdisciplinary. We're not limited to just psychologists. We're not limited to just counselors. We invite anybody who's in a mental health profession, psychiatrists, psychologists, social workers, marriage and family therapists, substance abuse counselors, into the organization. And we respect the unique identities of those areas, but we also recognize that there's tremendous overlap with those areas. So the second foundation of IAPC is that it's interdisciplinary. The third is that we are focused exclusively on professional issues. We're interested in education, training, supervision, and clinical practice. We do not weigh into the debate on social issues that are really political in nature. Because one of the things I recognized during my tenure as president of the American Counseling Association is that our membership covered a wide range in terms of political views, in terms of personal philosophies, personal orientation. And so my position was that a professional association should focus on areas of commonality that have to do with clinical practice, and that we should defer that social issues and social change are areas of individual conscience and politics. Now, having said that, I very much applaud, and I think it's laudable that people become involved in social issues to help advocate for and bring about a more fair and just society, provide equal footing, equal opportunities. But there are a lot of differences among people as to how we best go about doing that. So I think, again, those are areas of individual conscience and politics, whereas professional associations, I think, should be more narrow in their scope and should address clinical issues, education issues, and training issues. That's a pretty full plate for us. And so what we want to do is to support active research that uses scientific method and other areas of recognized inquiry to help inform the public, to help inform people so that they can make the best decisions in their communities and societies about how to move forward. But I don't feel it is our place as professionals to impose upon them our limited worldview of how we think society should operate. I think that's not the legitimate function of a professional association.
And I think the one of the responsibilities of psychological bodies, pretty much like the way a university works, it should tell you how to think, but not what to think.
Absolutely, that's spot on. I mean, the idea that we can look at all different perspectives and viewpoints, and then to think critically. That is, I would underscore what you just said. Absolutely.
And this is actually encapsulated in what you said in one of your vision statement. And if I could just quote here, you said, the aim of IAPC is to promote discourse and the open exchange of ideas in a respectful manner. But Dr. Canfield, I just want to touch upon with one point that you just mentioned, because you mentioned that a number of psychological bodies, APA, for instance, they have political bias. Can you just give us some evidence that there is actually political or ideological bias within the APA or mainstream organizations?
Well, I will, but I'm not going to use the term bias. I think that some of the professional associations that are out there truly believe that it is their mission to advocate for a better society through a particular viewpoint. And so I don't have a problem with them having that view. I simply disagree with it. I think a professional association should focus on issues. If you look back to writers in the field of psychology and counseling, Daryl Wing Su and others, who have said that, counseling psychotherapy is at its essence a political process. And so they look at it not only in a micro perspective, but also a macro perspective, in that they want to use the issue of therapy as a catalyst for bringing about social change. And I think that's dangerous. And here's why I think it's dangerous. If we as a profession use our position, whether it's as a psychologist or whether it's as a professional organization, to advocate for a particular path to improve society, then we are legitimizing the person down the street advocating for a different path to legitimize changes in society. So to me, that's a very slippery slope. I think that while we need to deal with those issues, those are political questions, issues of individual conscience, not of a professional association. Our job should be to provide unbiased, unblemished data so that policymakers, individuals, can make social policy to determine and bring about change. Now, at a global level, that has to be done within the context of the community. I've done work in Central Africa, in Rwanda, Uganda, Kenya, as well as the Middle East, quite a bit of work in the Middle East, Turkey, Saudi Arabia. And the way that you would approach addressing a problem issue in the United States, where I live in South Florida, is going to be very, very different than you would address it in Rwanda, than you would address it in Saudi Arabia, than you would address it in Turkey, because of the historical social value. So I think there's a tendency sometimes for people in the West, Americans in particular, to become somewhat arrogant and almost colonial in our views, thinking that we have the answers and we're going to impose those answers on you whether you like them or not. When I do my consulting work in other countries, what I say is this is what we do, or this is what I do in the United States, and I find it useful and helpful. Perhaps there's something from this that you can derive or glean that would be useful in your particular context. And for example, since 2010, I've been to the country of Turkey 32 times doing workshops and trainings, and it's been a delightful exchange. Turkey is a 98% Muslim country. But yet they have the exact same types of issues that we have in the United States, but they have to deal with it through that cultural, historical, and current lens that is quite different than it is in the United States in many respects.
There's actually a technical term for that when you said that Americans have a tendency to be kind of like domineering when it comes to talking about psychology, and they call it weird psychology. Western educated from industrialized, rich, and democratic countries.
Yeah, and I would be real clear about this too. That I'm not talking about it as a kind of a monolithic issue. I think there's a tendency for that, and part of it is because we are so highly represented in terms of the professional literature. The U.S., in particular, Western countries, UK, have been very prolific in terms of research and publication. So it's only natural. I'll give you an example. When I went and did the 10-day workshop in Beijing for about 90 Chinese psychologists, they were very clear that, the Americans have published a great deal. They knew a lot about individual psychology, but knew very, very little about systemic approaches to couple therapy. And some of the doctoral level Chinese psychologists had been educated in U.S. universities, so they knew enough about it to kind of bring it in. But they brought me in and two of my colleagues that I brought with me to do a series of training workshops on dyadic relationship couple therapy, and it was very, very well received. We've done 2 of those so far, scheduled to do 2 more, but COVID's kind of put the kibosh on that for the time being, but hopefully that'll open up before too long. But so I think it's kind of a fine balancing act. There are a lot of people in other countries who recognize that there's a wealth of knowledge and information coming out of the West, but we have to be very, very careful not to try to impose that upon our colleagues in other countries. I'll give you a good example. Colleague and friend of mine, Dr. Brad Keeney, had this perspective, and I kind of borrow from this. He said that what we call counseling and psychotherapy is only the most recent manifestation of a 50,000-year-old tradition of human helping. All human cultures have had people who played a role as a catalyst for positive change. Now, you may call them therapists, counselors, psychologists, or you may call them faith healers, you may call them curandero, you may call them witch doctor. It doesn't matter. These are people who have served a role in the community. And I think if we look at the human experience, that those traditions need to be honored and accepted. And there's a lot that we as Western psychologists, Western therapists can learn from these indigenous cultures and traditions of change. And I've built my career on intercultural issues in counseling and kind of studying and working with people in other cultures with that. And I think there's a tremendous amount for us to learn. But again, the U.S. and Western countries also have done a great deal in terms of the research and publication that many other colleagues in other countries wish to learn from and share from. So I think there's kind of a synthesis that can occur when we start to say, this is what works for us. Perhaps you can adapt it to your setting, and vice versa. We can learn things from other indigenous communities, other cultures that can be very useful in helping to evolve Western approaches to psychotherapy.
Now, Dr. Canfield, if I could just go back to the reasons why you have, being one of the people to have co-founded IAPC, is that, am I right in saying that IAPC aims to be politically neutral? And if so, because you were talking about how political ideology or bias, for lack of a better term, affects the landscape of psychology and the landscape of counseling. Now, if you could just talk, what's the danger of it? Let's say, for instance, if you're a counselor, you're kind of imposing your own political ideology. What's the danger in that?
I think it's a tremendous danger, but this is a very, very difficult issue to address, because the idea is that there's no such thing as values-free counseling or psychotherapy. For example, I have a value that I believe that human life should be preserved. So if a client comes to me and says that they're going to commit suicide, I will break confidentiality to impede them from acting upon that. And that's imposing a value. I'm saying, I don't think it's right for you to be able to take your life. I can't prevent it, but I can put roadblocks in front of you to prevent that from occurring. So the difficulty comes in is that when we start looking at views of how society should change, how things should, quote, improve, I believe all caring human beings want people to be healthy, happy, more fulfilled in satisfying life roles, contributing, making a difference with that. But we have a history of oppression. We have a history of unfairness. Life is not fair. And so I believe all of us strive to create a better world and create a better society. But how we do that, how we go about doing that, there are marked differences in terms of it. So when professional organizations or professional groups start to say, well, this is the way we think you should do it, and they exclude or criticize other approaches, then they're not really playing a professional role as much as they're playing a political role. And I disagree with that. I oppose that. Now, I want to be real clear. IAPC was not founded in opposition to the APA, ACA, or AAMFT. We're not here to say these guys are wrong and we're right. What we're here to say is this is how we choose to approach things. We think this is a better use of resources and effort and energy, and it's a more appropriate use of focus and resources among the professional community. So we're not founded in opposition to try to fight and tear down these other associations. We just think we have a better organization that resonates with people who are in helping professions. So our job is not to fight a battle to say we're right and you're wrong. We're just simply to say we have an alternative that we believe will resonate with a large number of people in the mental health field and in the larger society as well, which is also divided in terms of its perspectives. When we start to look at issues in the training of counselors or the training of therapists, and you start to see theories that emerge, so say, for example, critical race theory or Black Lives Matter and various things like that, people get very, very passionate about their perspectives on that, either pro or con with it. And what I would resist is any kind of institutionalization to indoctrinate and impose a worldview. You said this earlier, and I think it's spot on, is that we want to teach our graduate students and our professionals to analyze data and think critically. We don't want to indoctrinate them. So I go to great lengths in my classes not to indoctrinate. And I say to them, my personal views are really irrelevant to this process. This is what I want you to be able to look at and analyze and make sense of and put together for yourself. But in increasingly, the environment in the US and I think some other countries has become so politicized that if a faculty member deviates from the kind of the group think of a particular view, critical race theory being an example, then they are criticized, they're ostracized, they're canceled, they're called all types of horrible names, and their careers are diminished. I've had a number of younger colleagues contact me and have said, Dr. Canfield, I'd love to speak out and be an advocate for free speech, be an advocate for open dialogue, but I dare not do that. Because I could likely lose my job. I may never get promoted. I may never get tenured at my university because the political environment reflects in a particular way on that. So I think we live in a perilous time that challenges the intellectual integrity of the academy and the idea of free and unfettered speech. So in a small way, we are hopeful that IAPC will help promote those traditional values of liberal education. I mean liberal in the classic sense of an open exploration of ideas and concepts so that we can be informed to help create a better society. So yeah, to that extent, IPC, I'd say, is staunchly politically neutral in that we're not going to throw our hat in on a particular issue and say this is how it should be done. We will actively promote and support research, dialogue, open activities that will help people debate these issues so that they'll become better informed in order to bring about needed changes.
Mhm. Now, Dr. Canfield, you just said that we live in a perilous time when it comes to, this passion on critical social justice theory, or the Black Lives Matter has been sort of part of social science. I've been a member of 3 different psychological bodies in different countries, because I live in 5 countries before I came here to Britain. But I have to say that it's more visible when it comes to Western countries, whether the British Psychological Society or the American Psychological Association. Now, I'm just wondering if you have any theory as to how this, let's just call it passion. Do you have any theory as to how this passion about social justice have crept into the psychotherapeutic process or psychological landscape?
I've got two. I think it comes from 2 areas. First of all, I think it comes from the individual experiences of the people who hold a particular view. They may have suffered from racism or oppression. They may have suffered from injustice, and so it becomes a reason for them for them to kind of advocate and push to correct that. And I don't have a problem with that as individuals, but we all have different paths. We all have different experiences. So the path of a person who grew up in a country that was savaged by war, savaged by a totalitarian government, savaged by racial oppression, racial suppression, maybe South Africa, maybe the United States in the 1940s or 50s, their experience is going to be different perhaps than yours or mine may have been with that. So I think I respect the passion, but I am very leery of any group of people who want to impose their worldview upon other people. Share, educate, provide information, and reasoned people can change their minds and come to a different view. But when you try to impose that, then we're looking along the lines of something like occurred in communist China under Mao, when you had the Great Leap Forward, and you had the people who were put in education camps with that. And I'm not vilifying China; they have their history, but pretty much every other human society does as well. So there are periods where we have political thinking, mindset that one must view the world this way, or you're going to be ostracized, you're going to be vilified, we're going to get rid of you. And to me, that's incredibly disturbing, particularly if we are, as helpers, we base our knowledge on kind of open inquiry and without being prejudicial toward a particular worldview. So I think this is a battle that in many ways reflects the cultural battle that's occurring in many Western countries. And so again, get out, express your views, go to the polls and vote, elect politicians that you think reflect your particular position to the best degree. But I do not believe that this is a legitimate role for a professional association. We have far too much on our plate to look at effective clinical practices, educational training processes to produce competent and ethical therapists, whatever area they may be in. And so for me, that's what IAPC is unique in representing, is that we're focused on those issues, and that we look at the larger societal issues where they rightly should be looked at, and that is in the area of individual conscience or in politics. A parallel to this would be, say, a person's religious beliefs. You may be a devout Roman Catholic, Eastern Orthodox, Muslim, evangelical, Christian, whatever it may be, and your belief, your faith, your religious orientation has informed you. It shapes your worldview. It presses your worldview. Great. Go to your church, your synagogue, your mosque, for worship and for services. But when you start to say you don't have the right to worship how you worship, you need to see things as I do, then that can be problematic. And throughout human history, last 1,000 years or so, you can see that in Christianity in Europe, Islam in various parts of the world, that there's been tremendous conflict and bloodshed over the attempts to impose one religious view over another. And so I think that's kind of isomorphic. That's kind of parallel to what may be happening in the mental health field, is you have individuals who feel so passionately about a particular orthodox way of looking at things that they vilify, they attack, they try to remove the others who maybe think differently, or even have the audacity to question, to say, well, yeah, you believe this, but perhaps there's another way. Perhaps we can look at it. So the idea of even questioning is somehow considered antithetical to the political orthodoxy. So again, I hope IAPC can have an impact on the professional community globally, to allow us to come together and share ideas and debate and use research, use clinical practice outcomes to help improve the human condition. That's a very ambitious undertaking, but I think it's one that's laudable.
Okay. What I'll do is I'll put the link to IAPC, so for anyone who's interested to join this organization, they can learn more about it.
Sure. They can join IAPC and go to INT, which is short for international, INTAPC.org. So again, INTAPC.org, and it'll take you to our main website. You can join online. You can also join in your local currency. We have about 100 different currencies worldwide, so that if you're, say, in Turkey, you could join online, paid with a local credit card in Turkish lira, and we convert that. We also have, in some of the more developing countries, we can offer a modest discount code to reduce it. We also structured the annual membership fee low to begin with. It's probably about half of what some of the major associations are. But the professional fee in the U.S. is $139 per year. And then in other countries, it's going to be less than that. So go to the website. If you have a question or inquiry about, you're in a place where the income is much, much lower, contact member services. They can give you perhaps a discount code depending on your circumstances with that. But again, that website is INTAPC.org. And we would welcome your questions, and we would welcome your being part of this growing association.
Now, Dr. Canfield, I just want to come back to what you said earlier, that IAPC aims to foster open debate. So I have a sort of situational question for you. I understand that you're also planning to launch an academic journal. Is that right?
That's correct. Yes.
Correct. Okay. So let's say, for instance, that would you also allow it to publish contentious topics in psychology on your journal? There are contentious issues in topics in psychology, say, for instance, race and intelligence. You said that you are for open debate. Would you allow that to be published on your IAPC journal?
Well, that would be a determination by the editor, the editorial staff, and the reviewers. But my inclination would be is that absolutely, as long as it is approached in a scholarly manner, as long as it is not crafted in a way that is to indoctrinate to a particular view, authors certainly can draw conclusions and recommendations and things like that. So we would not want to be engaging in the same activity that we're talking about. But the idea that you're going to have a study that is a qualitative study of three people who are like-minded about that to advance a particular view, again, I think that's an editorial decision that once we assemble that, that the position will be. The journal will clearly state that it invites research related to education, training, supervision, and clinical practice. So that's going to be the scope of it with it. And if these other areas kind of come into the issue, the article is well written, well researched, balanced, then I would see no impediment to an article being included with that may have differing viewpoints from differing people on that. But again, I don't want to predetermine that. And we've got some people who've stepped forward to who wish to be part of this journal activity. And I would anticipate we'll probably launch this within the next 12 to 18 months.
Well, I look forward to reading some of the articles when it finally issues its first publish its first issue rather. Now, Dr. Canfield, we're already approaching the end of this interview, and we learn about your work as a counselor, and we also learn about IAPC. Let's get to know you a bit more as a person. So I've prepared 5 questions for you so we could get to know more the human side of Dr. Canfield.
Sure.
First off is, do you have any tips for those who want to follow your footsteps of becoming a family counselor?
Make sure that what you do you're passionate about. It's very, very important. Now, I'll share with you my history. I went to college, didn't know what I wanted to major in, had to declare a major. So I declared psychology with the full intention that I would probably change it into business or something like that. But the more courses I took, the more interested I became. And just I'm one of the few people who started out as a psychology major and graduated. In the United States, of course, psychology is a doctoral level program for practice. And so I got my master's in counseling, my doctorate in counselor education and supervision with a comprehensive minor in psychology. And my dream had always been to go into clinical practice. So I opened up a practice in Louisiana, and I was in private practice exclusively for the first 6 years after I completed my doctoral program. Now, I did some adjunct teaching at a university, would teach a class here or there on a one-off basis, but I was a clinician. And then some years later, I did a presentation at a professional conference, and the associate dean, Dr. Don Locke, came up to me and said, we have an open faculty position. Would you apply for it? And I said, well, I've never seen myself as an academic. I've always seen myself as a clinician. But I applied, and lo and behold, they offered me the job, and that launched a 35-year academic career that I've maintained kind of parallel with that. So I would say my advice is to be passionate about what you do. Recognize that the work that we do as helpers is we're privileged, because not only can we make a living, earn a living with what we do, but we can also help people in the process, and that's few and far between with many careers. We help people, but we can also support ourselves and our families as well. I would also say that, keep an open mind to learning. It's a lifelong process. If you ever think you've arrived at the point that this is how things are, you should question it and go back and say, well, in science, we can say, this is what I believe based on the information I have up to this point. But I'm always open to new ideas and new experiences that help shape my views with that. At a personal level, I've got 5 children, ranging. My 2 oldest daughters are both moms themselves, and I have 5 grandchildren. I put a premium on family relationships, and I have very fortunate to have a group of supportive colleagues that many of whom I've known for 20, 30 years, and we are able to kind of create that support for each other in terms of our professional activities. And that was really the impetus behind the founding of IAPC, is that I queried a group of colleagues who I trusted, looking for feedback, and I was expecting to get a mixed response. Yeah, maybe not. To a person, all of them said, this is time. We need a new association that offers a different perspective for the professional community and for the public that we serve. So again, IAPC is there to advance our knowledge, to advance excellence in clinical practice and education. We're not there to throw brickbats at other associations and to say that they're doing an awful, terrible job. We're just simply saying they do what they do and we do what we do. And I look forward actually to collaborating with many associations at the local level, regional level, country level, who have issues and values in terms of research and education that complement our own. I'll give you a good example. For the last 18 years, I've directed the Oxford Family Counseling Institute at St. Hilda's College at Oxford University in the UK. And this was done for about half of that time under the aegis of the IAMFC, International Association of Marriage and Family Counselors. This will be something that's done under the aegis of IAPC, but we plan to partner with IAMFC as well and other associations. This is a week-long symposium that comes together to look specifically at clinical issues, research that have to do with couples and families. And we plan to organize and sponsor these on a global basis, and over the next couple of years have plans to offer this pretty much around the world. And so those of you who are able to support IAPC and join as a charter member, we would love to have you on board and share this information with you, and hope to have you as part of this growing movement.
And Dr. Canfield, who inspires you both professionally and personally?
Who inspires me both professionally and personally? My religious faith has played certainly a central role in that, but I don't wear it on my sleeves. And certainly my views, I have many friends from other religious faith and views who are similarly influenced by that. I think that's given me a sense of fairness and grounding of human morality, of treating people fairly, treating other people like you would like to be treated. At a professional level, I've been influenced by many folks, and I'm more an advocate of ideas. Certainly, going back to Carl Rogers, I'd say Gregory Bateson has been an influence, philosophically. At a more personal level, I've got an array of former professors who have become friends and colleagues, and just off the top of my head of that would be Dr. Don Locke, Dr. David Fennell, Dr. Alan Hovestad. Dr. Robert Smith recently passed away several weeks ago. His former ACA president, was a dear friend and former professor and a colleague for many years. And I also have a lot of contemporary colleagues who kind of came up through the profession with me that are just great supportive individuals, and I'll not go into naming all of them, but I'm blessed to have a group of colleagues that I can call upon, and they can call upon me. And again, I'll go back to one of my central issues is it's all about relationships. We need to find ways to connect with each other. We need to find ways to cultivate relationships with one another. And that's where the growth and support comes from. Organizations don't do anything. People do something. People make things happen. And we organize ourselves into groups and into associations to kind of create a collective voice. But it's those individual relationships that are critical and important.
And how do you relax? What's your de-stressing outlet?
Great question. I love to play the piano. In fact, during the COVID, I started picking up piano again, and I would sing songs for my friends and post it on Facebook and semi-embarrass myself and with that. So I love music. I've really encouraged my children to like music. For about 25 years, I was very active in martial arts, but I'm a little up in years with that. So no longer in the dojo like I was before. But love doing that. Love good food, spending time with family and friends, people who are close to me. But yeah, I'd say probably music is one of the ways that I decompress. Love to read, love to travel pre-COVID, and I've missed that. So I'm hoping that opens up pretty soon again as well.
Everyone is hoping to, that everything would be, that we would be allowed to travel soon. What do you think you would be doing if you didn't work as a counselor?
I would be doing construction. I worked myself through college working construction. My dad was a blue collar construction guy, and I'm pretty handy with a hammer. I'm pretty good. In fact, I'm been spending the last month in my home in Louisiana, and my son and I re-roofed the house, reshingled the house with that. And people saying, "Why do you get on the roof and nail shingles into why don't you hire somebody to do that? You can take out your checkbook and do it." And I said, "Yeah, I could, but I said there's a certain satisfaction in taking on a task, putting your energy into it, and then at the end of it, stepping back and saying, I helped build that. I can do that. I have a skill with that." So I'd say if I were not doing academic work, I'd probably be building things physically.
Interesting. And finally, Dr. Canfield, what else is in the pipeline? And if people wanted to reach out to you, what platforms can they get in touch with you at? Sure.
Yeah. If you want to follow up and contact me, you can contact me at Brian, BRIAN, at INTAPC.org. That's my email address with the association. And or you could also contact me at my university email, which would be bcanfield, CANFIELD, at FAU.edu. So either of those. And if you have any questions about IAPC, would be glad to share it with you. But I really would like to, again, extend the invitation. We just opened up operations officially July 1st, so we've been around less than a month, and we've already doubled our membership in a couple of weeks with that. And so we would welcome your opportunity. We also have leadership roles available. We currently have members in 14 different countries, and in about 12 of those countries, we have chairs for the country. So we have a chair for Turkey, we have a chair for Cyprus, we have a chair for Rwanda. We have, growing number of countries with that. So if you're interested in being part of this movement, we would welcome your membership. But if you also want to become more active and play a leadership role, we're going to be organizing that on a global level as well. So this would be an opportunity for someone launching their career earlier in their career, wants to get a head start on leadership opportunities, that IAPC offers that for you.
Brilliant. Dr. Brian Canfield, it's a pleasure having you here on the DRH show, but unfortunately our time is up. I look forward to hearing more about your work and also about the development of IAPC. Thank you.
I appreciate the gracious invitation. This has been delightful, and I look forward, hopefully, to talking with you again in the future.